As with any surgical procedure, there are risks involved. Some relate to the surgery.
Anytime you break the skin with a needle or a knife, we always tell our patients that there are risks, there are complications, there are side effects.
When you have a permanent implant with an intrathecal device, one of the surgical risks that we always worry about is the risk of bleeding. But once you have healed, that risk is substantially decreased.
Bleeding would be a significantly uncommon, I want to say rare, but uncommon event, and we always make sure that patients are not on any anticoagulants or drugs that would cause bleeding. Prevent them from clotting, if you will. Infection is a real possibility, but we implant these things in an operating room in an extremely sterile environment, or if you would like to think of an operating room as the most sterile environment you can get.
And if these devices become infected, they often have to be removed, and it has to be taken very seriously.
Because we're actually going into the intrathecal space, meaning the sac that holds the spinal fluid. There can be something called a post-dural puncture headache. It's not life-threatening. It can be repaired either surgically or by doing something called a blood patch.
There's also the risk in people that have intrathecal pumps of getting a small, what we call a granuloma, which is a growth at the tip of the catheter of a pump. And that's something that we have to monitor people for that have these devices for a period of time.
Other risks relate to the medications being used.
Opioids, whether they're taken by mouth or whether they're delivered by the pump, have side effects and concerns that you always need to be worried about. One of the side effects we worry about is we want to make sure that you continue to have good breathing and that you have no decreases in your breathing rate. And so we watch for that in the holding area.
In men, we can see urinary retention. We always have to make sure that that resolves prior to doing an implant when we do the trial.
One of the downfalls of having a pump is it affects your testosterone levels. Because of being on an opioid, that's where the first thing it affects. And my sex and my attitude and everything was just getting to a point where I didn't feel like doing anything. I got lazy. So to cure that problem, they give you a cream, an androgel it's called. And every morning after your shower, you just open a little pack and rub one around each of your legs. And in about 6 months, I had my blood work redone and my testosterone levels were right back where they were. So that's one of the things that you have to do for the remaining time that you have the pump, because it does work on certain things in your body.
Some risks involve the device itself. It's important to stay alert to problems, especially those that can cause an overdose of your medication.
With any implantable device, one thing that you worry about is how well the system is going to function over the long term. And many individuals, these systems function very well. But there also can be complications.
Movement of the catheter inside the cerebrospinal fluid is a possibility. And that should be suspected if the patient has significantly increasing pain in spite of the fact that the doses are escalated. The patient has an abstinence syndrome, meaning that the medication is not getting into the cerebrospinal fluid. There are several possibilities for that. One, the pump itself has failed, which is an extremely uncommon event. It can happen. Two, there's a disconnect from the catheter at the pump site. Three, there is a break of the catheter in between the pump and the cerebrospinal fluid, or the catheter itself, the tube that delivers the medication, is completely outside of the cerebrospinal fluid. It does happen, but it's extremely uncommon.
But if for some reason you have difficulty with your pump or difficulty with your catheter and the drug is not getting infused properly, it's possible that you could have either an overdose or an underdose. And an underdose could lead to signs of withdrawal. If you're starting to get signs of withdrawal, that's very important that you call your physician to seek help.
But what we do typically do is, one, interrogate the pump to make sure that the pump is in fact working. We evacuate the pump to make sure that we're getting the medication that we expect to get. And the little computer that we have that we place over the pump will tell us that. Then we do something called a dye test. We place radiopaque dye, meaning a solution that we can see under X-ray guidance. We inject it into the pump and we track it through the catheter into the cerebrospinal fluid. If the dye is not delivered directly into the cerebrospinal fluid, there is a disconnect somewhere.
So there are complications that can occur with the equipment, and we have to watch for those and monitor for those.
First thing to do is go back to your physician. Your physician is the best person to determine what, if any, problem exists.
Here are some questions you may want to ask. Do I have any conditions that might complicate the surgery? What symptoms should I watch out for that could indicate a problem? What should I do if I suspect a problem?